Welcome to our press briefing today. My name is Robert Resendes, R-E-S-E-N-D-E-S. I'm the Health Director for the City of El Paso, and we have some updates we'd like to share with you today regarding our TB event and incident that's been ongoing now for several weeks. Today we're announcing, since our last meeting, 3 new positives on our babies. We have what we call 1 true positive and 2 babies. Although they tested positive, they were previously vaccinated against tuberculosis, so we're assuming those to be false positives. So of our 11 positives that we've had to date, 7 of those had received the BCG, or the TB vaccination. We have 4 true positives, and those were born in 1 in September, 1 in December, 1 in January, 1 in February. So we're definitely seeing a winter month cluster for our true positives. And we've thrown around the number of an expectation of a 1% infection rate. With these numbers, we're seeing a 0.7% infection rate so far. We're not finished yet. Our denominator remains the same. We identified 860 babies that we thought would be at risk for exposure. Of those, we're now at 95% of those babies and their families have been contacted. If you recall, we started with about 70% the first week, and then 80% the second week. It's going to get slower now towards the end, but 95% contact in less than a month is really good. We're happy with that. Of those patients identified, 643, or 75% of them, have had or do have appointments here at the health department. There's always several others who are getting their appointments somewhere else, other countries, other states, private physicians, and it'll take us a while to get that data. Those who have completed their screenings here at the health department, 569, or 66%, 2/3 of the babies identified. And we have now identified 93 of these babies live outside of El Paso or are getting their health care and follow-up somewhere else. At this point, this morning, meeting with our staff, we're shifting our operations from a testing phase to a treatment phase. But we're not going to stop testing. It's just most of it's already done. But we're still going to try to hunt down those missing babies that we haven't been able to find and to get them either in to see us or to see a physician somewhere. We've already scheduled 312 of our babies for follow-up, and that's going to go out as far as February of 2015, the end of February. So although the bulk of the work has already been done in terms of finding and testing the babies, retesting the babies and making sure they're okay, it's going to go out till at least February of 2015. Anticipating the question that's usually asked by this group is what's happening with our index case and our close family. We've tested all of them, and so far there's been no conversions, but we test them twice, once right away, and then we'll wait several months and test them again to see if it was perhaps a delayed infection. But as of today, there's been no secondary cases associated with the household members of our index case. And with that, I want to turn our time over to our health authority, Dr. Hector Ocaranza.
Thank you. Good morning. I'm Dr. Hector Ocaranza. I'm the health authority for the city and the county of El Paso. We want to emphasize a little bit more about the window prophylaxis that we have been talking about. We want to stress the importance about the treatment offered to those babies that are less than 6 months. We feel that those babies that are less than 6 months are the most vulnerable, and that's where the window prophylaxis is going to give them the benefit of not having to worry about converting to be positive later on. As a reminder, this is a 2-visit step for those babies that are 6 months and under. So initially we put the PPD test, we do the chest x-ray, but at 6 months that's when we're given another appointment so we can retest those babies and do another PPD, follow up with another chest x-ray and make sure that those that were negative still are negative, as Mr. Resendez was saying. So the window prophylaxis is that, giving the medication while we test them again at 6 months and make sure that those babies are still going to be negative. If at that point a baby that didn't receive the window prophylaxis becomes positive, then it involves a different process, and we're a little bit more concerned. So we want to stress that to the parents, not to be concerned about the medication. The medication has been proven to be safe, has been given for a lot of years, and it has proven to give benefits to the babies. So far, we have a very low response rate as far as accepting the window prophylaxis, and we have 29 babies on window prophylaxis out of the 205 that have been recommended, which is a little bit shy of 15%, has accepted the treatment. So we need to give the benefits and also the side effects of the medication to the parents, and we'll give them some time to think about it and make sure that they discuss it, make an informed decision as far as taking the medication. But we want to stress the importance about giving the medication and the benefits that that is going to give. So for those parents also that came for the first visit, placed the TB test, we want to make sure that we need to read that test 48 to 72 hours later. So if they didn't come back, please come back. If you don't come back, we need to start over again. And we want to make sure that the baby's fine. So we want to invite those parents that didn't have enough time to come back. Please come back, make the appointment, follow up with the visits that we're recommending. And also for those that have already completed the first step, thank you very much. We really appreciate that they came. But we need to do it again when the babies are 6 months. If those babies are older than 6 months and they were negative, we're very happy that we have seen that and that we have an increase in the number of positive babies that we have. So again, we thank all the parents that have come and have made an effort to come. We really appreciate that, but we're inviting those that haven't come back. Please come back and finish with the screening process.
2 points I failed to make is that we still have absolutely 0 active cases of TB. We hope it stays that way, we really do. And the other thing is part of our scale down efforts, we had nurses from all over the state, Department of State Health Services, we had CDC. The majority of them have returned home because the majority of the work is completed, and it will be mostly our regular staff and some state health folks that will be hanging back for another week or two, who will be helping us finish off this bulk first wave of testing. Questions?
Que nos repita en español.
Dr. Carranza habla español.
Ahora sí, buenos días. Lo que vamos a informarles ahora de que más que nada tenemos 3 casos nuevos positivos. 2 de ellos recibieron la vacuna de la BCG, que es una vacuna que no se usa de rutina aquí en Estados Unidos. Y hay uno que sí fue positivo que no recibió la vacuna. De esos 11 positivos que tenemos, 7 han sido vacunados contra la tuberculosis con la vacuna de la BCG. Y hay 4 que no son falsos positivos, son positivos. Todavía estamos por abajo del 1% del umbral que tenemos designado para la infección, y estamos aproximadamente en el 0.7% de esto. Tenemos unos positivos que nacieron en septiembre, en diciembre, enero y febrero, y casi acabamos con todo de localizar a todos esos pacientes. Tenemos unos pocos más de que fueron localizados en otros estados o fuera del país, son aproximadamente 93. 66% ya completaron todo el proceso de pruebas de escrutinio, y tenemos el 71% que ya completaron la primera parte. Sabemos que estas pruebas es un poco tedioso porque tenemos que hacer las pruebas en el brazo y más aparte la radiografía. Y a los babies que son menores de 6 meses tenemos que volverlos a repetir a los 6 meses de edad, otra vez con la prueba de la tuberculosis en el brazo y la radiografía para estar seguros que están bien. Queremos exhortar a todas las familias que no regresaron a hacerse la lectura de la prueba de la tuberculosis en el brazo que vengan. Desafortunadamente, si no volvieron las 48 a 72 horas, van a tener que empezar otra vez el proceso. Sabemos que es un poco tedioso, pero sí les pedimos de favor que vengan para acabar con todas estas pruebas y estar seguros que sus bebés están bien. Una de las cosas que queremos recalcar también es el tratamiento que ofrecemos de profilaxis contra la tuberculosis. La isoniazida es un medicamento que hemos usado por muchos años, es un medicamento seguro, de que tenemos que informar de los riesgos y los beneficios de este medicamento a los papás para que hagan una decisión informada de esto. Tenemos que hacerlos, pero los beneficios que le vamos a brindar al bebé al darles esta medicina sobrepasa todo el riesgo de cualquier efecto secundario que podamos tener. Hemos visto que esos efectos secundarios son mucho más comunes en gente mayor y no tanto en niños. Entonces, sí hay cierto temor y miedo en los padres para dar este medicamento, pero queremos asegurarles que ese medicamento lo hemos dado a muchísimas personas, incluyendo niños, y vemos que es un medicamento seguro. Queremos ver que estos niños estén sanos y que no vengan después a los 6 meses y que ahora sí ya se convirtieron en positivos y tener que cambiar nuestra estrategia de tratamiento.
Ok, entonces los 11 ya están en tratamiento actualmente. ¿Cómo se han sentido? ¿Cómo han estado observando a los bebés?
De los que estamos dándoles el tratamiento profiláctico son 29. De los 206 que hemos identificado que necesitan darle tratamiento. De los 9 que tenemos positivos, estamos haciendo la investigación todo alrededor de la casa, porque también tenemos que ir a la casa y hacer la investigación para estar seguros que no hay nadie más en esa casa que fue la que le transmitió la bacteria a los bebés. Hay que recalcar también que los bebés reciben la bacteria de la tuberculosis de un adulto y los bebés no la transmiten a los padres para que no haya esa confusión también.
Entonces, nada más para aclarar, fueron 29 los que dieron positivo.
29 están en tratamiento profiláctico nada más porque son menores de 6 meses. Son los que han aceptado recibir el tratamiento.
Ok, entonces cualquier bebé menor de 6 meses recibe tratamiento.
Se le ofrece el tratamiento
Ok,
y a los 6 meses tenemos que volverles a hacer las pruebas otra vez.
pero solo 11 han dado positivo al examen.
Sí.
Y de esos 11, 4
Son,
los que no recibieron la vacuna.
exacto.
Y de esos 4, ¿cuáles son los que tienen la tuberculosis activa?
Ninguno, no tenemos ninguno con tuberculosis activa.
Pues solamente el 15% lo ha aceptado. Y este 15% de todas maneras tiene que regresar al examen a los 6 meses.
A los 6 meses, y a los 6 meses si está negativo, descontinuamos el medicamento y estamos contentos de que no pasó a mayores.
O sea, los padres de familia están pues, preocupados. No pensé que fuera tan poquito. Pues.
Es desafortunado que son tan poquitos padres que han aceptado el tratamiento. Muchos de ellos expresan el temor de que le van a dar medicamento a un bebé, pero realmente, como les decimos, el tratamiento es para prevenir y que no se vaya a desarrollar a un tiempo a futuro la tuberculosis activa si acaso tuvieran
En
la
otra
bacteria.
conferencia de prensa, ustedes dijeron que iban a monitorear efectivamente a esos que sí recibieron el tratamiento. Si puede reiterar eso, por favor.
Claro, cuando les ofrecemos el tratamiento y aceptan a recibir el tratamiento, las personas del Departamento de Salud van a la casa de ellos, están monitoreando, le dan el medicamento 2 veces a la semana y les preguntan a los padres, tratando de monitorear algún efecto secundario, algún síntoma que puedan tener que sea relacionado a la medicina. Entonces, nuestro personal está capacitado para hacer eso y identificar a aquellos que puedan estar desarrollando algún problema con el medicamento.
Dijo que son 205 los niños a los que ustedes les han recomendado tomar el tratamiento. En estos 205, asumo, están los 11 casos que han dado positivos con o sin vacuna, ¿sí?
De los 11 hay unos que sí, hay otros que no, porque hay unos que nacieron en septiembre o diciembre que ya tienen más de 6 meses. Si sale positivo y son de los positivos que no reciben la vacuna, se les va a ofrecer, pero tenemos que acabar toda la investigación alrededor en la casa.
Pero si son 205 los que sugieren.
Los que les recomendamos el tratamiento
Por ser
profiláctico, sí.
menores o por haber salido positivo.
Ujú.
Luego
Ok.
usted había mencionado 9 casos que están...
Ah.
había mencionado 9 casos que están después investigando o monitoreando en las casas. Esos 9 casos, ¿cómo se relacionan con los 11 que dieron positivos?
Los 9.
Y dijo que 29 están en tratamiento profiláctico y de los
Sí.
9 positivos...
Son 7 que tuvieron la vacuna, la BCG. Y no, 200, eran 29 veces en tratamiento profiláctico de 205 que les hemos recomendado.
Pero luego mencionó 9 casos.
Entonces eran de los 4 positivos, a lo mejor me confundí, eran 29.
Ah, ok.
Eran 29 de los que están recibiendo, que aceptaron el tratamiento profiláctico.
¿Podría mencionar acerca del costo de estos tratamientos que están ofreciendo a los bebés? Hasta ahorita cuál es el costo que se ha llevado por todo este periodo de análisis y ahora de tratamiento?
Bueno, el tratamiento que se les ofrece a los padres es gratuito a ellos.
No, yo sé, pero por ejemplo...
¿Cuánto le cuesta el
todos
Estado?
los datos que se han realizado por parte del hospital para poder detectar los casos de tuberculosis, ya sea los exámenes, radiografías.
We can tell you all the cost of all these operations, on the X-rays, screening.
The x-rays the hospital's paying for, so
Yeah,
that's-
then know
they're
the
taking care
cost
of
of
that.
the whole.
So far, our first bill for September, I think, was 17,000. From September 22nd to September 30th, 17,000.
De septiembre 22 a septiembre 30 como $17,000, pero están todavía acumulando y mandando esa factura al hospital.
Todo lo va a cubrir el hospital público.
Sí.
So the CDC and state are paying for them themselves, they're not charging the hospital.
Okay.
CDC and states, gratis.
Sí, el servicios que hemos recibido del CDC y del Departamento de Salud del Estado, ellos no le están cobrando al Providencia y están dando sus servicios por medio de sus fondos.
¿El tratamiento es jarabe?
Son pastillas que se muelen y se los administran en un poco de, ya sea en la fórmula o en alguna otra comida que se le dé al bebé.
¿Y eso es diario?
2 veces a la semana hasta que cumpla 6 meses.
What would
Tenemos-
you say accounts for the reluctance of these recommended patients from taking these preventative medications?
Probably the reluctance comes from parents being concerned about giving a medication to a baby, especially when they don't see any physical signs of illness. So it is extremely difficult for a parent to conceive that you need to give a medication to prevent the development of a disease when you see that the baby is perfectly healthy or normal. And also another concern is the side effects, the possibility of side effects that can come from any medication. As we know, any medication has side effects. So
What are the side effects of this medication?
side effects of this medication include gastrointestinal problems. We can have problems in the liver, and those are the most common ones. As they get older, they can be seen a little bit more often than when they're young. So when parents read over the internet probably on the side effects of this medication, there's not that much data that they can find regarding the babies taking this medication compared to the whole universe, from the whole spectrum of life, from older people to young people. Older people, when they have other chronic conditions, their liver, all the organs are more affected by other chronic diseases and other medications. That can pose an interaction with adding an extra medication.
How is this medication administered?
By mouth. The employees from the health department go to their houses. Their infants, they're crushed, and they're put into some puree, see if they're able to tolerate solids, or they put in a little bit of formula so the baby can take it.
What's the name of the medication?
Isoniazid, and the short is INH.
How risky is not taking the medication and wait until the baby to get 6 months?
The risk is if you don't take the medication and the 6 months come and you have the screening and then you become positive, then we need to investigate it throughout the house, and something that could have been prevented by giving the medication for some time until their year 6 months.
Y se les va a ofrecer el tratamiento gratuito a las personas que, por ejemplo, si ahora no aceptaron el tratamiento para su bebé menor de 6 meses y en un futuro desarrolla la enfermedad, ¿aún así se le va a ofrecer gratuito?
Claro que sí, el tratamiento va a ser gratuito. Inclusive si alguna de las otras personas alrededor de la familia sale positivo, se les va a ofrecer de la misma manera a ellos.
You said that if people, the risk of babies not taking the treatment is when they get to 6 months and they test positive, you would have to investigate the household.
Definitely.
But didn't babies not spread the disease?
Exactly, the babies don't spread the disease, but if you have somebody in the household that is spreading the disease to the baby, we need to know and identify those adults that might be positive that also.
Oh, so it's not that the babies, if they don't take the preventive medicine, they would spread it to?
No.
Okay.
And these are families that have been in contact with the nurse, or are these families whose babies have tested positive?
No, it's babies that have tested positive. We need to test the household. Because once again, the adults in the household can be the ones having the bacteria or having the disease without knowing.
¿Y ahorita cómo se encuentran esos 29 bebés con el tratamiento? ¿Alguno ha tenido los efectos secundarios que mencionaba?
No, ninguno ha tenido ningún efecto secundario y han estado muy bien.
What makes these 205 babies more needing to have these treatments?
Actually, those 205 babies are less than 6 months, and being less than 6 months makes them more vulnerable their immune system is not as developed as older babies, and that's what they consider a little bit higher risk.
So with the efforts changing, you're shifting gears, what will we be seeing as the difference? Will you be having less times available for testing? What will be the impact?
Yeah, we've been testing Fridays, even Saturdays if necessary, so we'll be back to a regular Monday to Thursday city schedule of business. Where we are making some adjustments, as we've started doing the treatment at home, we've had some parents who expressed concern. They both work, the baby's in daycare, and our hours of operation don't match theirs. So we're going to shift some of our people to like a second shift, so they can go in the evenings to some of these families' homes and accommodate their work schedule accordingly and make sure the baby gets the treatment it needs.
Si se llegaban a presentar algunos efectos secundarios, ¿qué tanto tiempo pasa de que tomas el medicamento a que puedes presentar?
Puede tardar mucho tiempo, todo depende del bebé. Acordémonos que más que nada es el bebé o la persona que toma la medicina que se toma, y la interacción entre las dos es muy diferente de una persona y la otra. A veces puede tomar mucho tiempo. No, realmente tomando la medicina a veces se presenta después de unas cuantas dosis, a veces se presenta casi al final del tratamiento.
Okay,
No
pero
sabemos.
nada de que cuando tengas 29 años te va a salir con otro.
No.
Can you repeat that in English?
Sure. The medication is not going to give you the side effects later on, 20, 30 years later on. If we are going to have side effects, it's going to be taking the medication, but we need to remember that the medication is not only the medication, but the host or the patient taking the medication. So that interaction between medication and patient is also important, and the side effects we might expect to see them initially during the treatment or probably close to the end, but it's not going to happen 20, 30 years later.
Can you talk to the size of the baby's liver as compared to the small dosage, because it is such a small child, and how that's kind of been presented by some studies to show less effect?
Sure. The medication, since it's metabolized by the liver, and the liver in the babies is healthy, is not being affected by any other medications, any other diseases, it is a lot more effective at metabolizing medications and has been growing well so far since they were born. Unless they have other chronic conditions that we're born with, then that's why those babies are considered very healthy and very able to take the medication.
What kind of current other outreach efforts are there to try and get more of these babies that have been identified on these preventative treatments?
The ones that have come in, we've had the face-to-face with a nurse, with a health educator, sometimes with the physician. Some of them are going to their own physicians as well.
We also we also develop some parent information packet. So whenever they come to the clinic, we give each and every one of those patients a package showing this is the timeline, how we're going to be screening your baby, this is what the recommendations are going to be. This is some information even regarding the chest x-ray. Some parents might have been concerned about the radiation that they're going to be exposed. So the side effects, the radiation from the chest x-rays, explaining in very simple terms to the parents. We created some videos so while they're waiting, we also address some of those concerns with the parents. So whenever they come to the room with the nurse, they can have more questions and they can have all those questions answered by them.
So once those parents leave and they've not accepted the treatments and we don't want to sign up for it, has there been any other kind of direct reach out to them being like, we urge you to reconsider at this point or anything like that?
There has not yet, because we're still just finishing the bell curve of folks, and then we'll start in on that.
So that is planned?
Yeah, kind of call them up, like, have you had a chance to think about it? Some people want to talk to their physician, Google research, whatever. So we'll be calling them up and see if they've had a change of heart, encourage them to come back in.
And you mentioned in the last press conference that the last 5% is actually the hardest to reach. What other efforts are you doing to locate these people?
And we're there, we're at 95%, so we got that last 5%. We have requests, and there's various databases that exist in the state that these babies may be in, but we have to get permission to get access to those because we're in the middle of a public health investigation. There's lawyers and things, but we're going to get there. So we're going to ask to see the WIC databases, to see if these babies are on WIC anywhere in Texas at least, and if not, we can probably look at New Mexico as well because it's close by. Immunization databases is another great one. If they're taking their child to a pediatrician somewhere, that data gets captured. It shows up on on Austin's statewide database. We know that child's getting medical care in greater El Paso, and we can work with that physician to hunt them down.
What about insurance companies?
We have not reached out to them yet, but interestingly enough, some of them have reached out to us saying that when you get to this 5% time, we'd be willing to help you as well. So that's another one of our options. Thank you. And we may never get to 100%. I hate to say that, but that's the reality of it. If you have really transient, maybe homeless families, they're really tough to find. The fact that we're at 95% in less than 4 weeks is kind of phenomenal, actually.
And one of your children was in this situation, just to clarify, you both were going to pack and help with that.
Oh, definitely. If I had a baby that is recommended to be prophylaxed, I would do that.
Prophylaxis and fully immunized.
You can answer this in Spanish, or just get it to answer it in English. Who is paying for this testing that's going on right now?
The hospital has stepped up, and they said that they'd cover all the expenses. The CDC folks that have come here, they won't be charging the state, the city, or the hospital. They'll just eat their own costs, if you will, as well as those from the Department of State Health Services. They'll be doing that as well. And the hospital provided several nurses. They're providing for the x-rays. So at the end of the day, the billing, the costs will be city expenses involved with this long-term effort.
And does that include the medication as well?
Medication's free, comes from the state. And the patent has long run out on this stuff. We've been using it for 100 years, so it's pennies for the medication.
Do you know costs at all that the hospitals require?
I don't know what their cost is in terms of the x-rays or their nursing time. I know that we've billed them $17,000 for the time our staff spent on the project in late September.
How is this event prepared the department for future emergency type situations where there's so many people involved?
Well, I don't think it was so much a preparation, but an affirmation that all the planning we've done, the drills that we've done, came to fruition. The size of it, we didn't have enough staff, but it was good to know that we could call our neighboring counties, State Health Department, CDC, and that they could send resources in to help us. It would be somewhat foolish to always have an overstaffed staff waiting for the large event, but knowing that we can call on people and they can be here in a matter of days. It's efficient, it works well. For this type of scenario, it worked very well.
Have you had any communication across the border? There are some babies that were born here and then they move back and you have a few false positive. Have you been in touch with people over there?
We have a liaison that works with the TB folks, and she's in touch with them every day, and we meet with her almost every day now. We used to have our meetings every morning at 7:30. Now it's twice a week. It'll probably go down to once a week. But she reports regularly, and she turns in her data, so it goes into our centralized database so we can track the children. There's been some issue of, where are the children living? It's interesting. I personally, I don't care. As long as we find that child and we treat them. I know in some of the earlier reports we had a child in Montana. As we've dug further into it, that child was never in Montana. That was the parents' mailing list when they checked into the hospital. So our work with Montana helped us to learn that child has never been in Montana, but it lives in El Paso and is being seen in El Paso, but just happened to register at the hospital with a Montana address. So it's been a little tricky trying to find these people, but we're doing it.
I'm sorry, you may have answered this already. The 11 that tested positive, where are they from?
I'm sorry?
Out of the 11 babies that were tested for TB, where are they from? Are they mostly from El Paso? Or are they
10 and 1, 9 and 2. He's looking it up right now, so don't forget that. It's either 10 and 1 or 9 and 2, U.S., Mexico, with the bigger number being El Paso, U.S.
TB is a common problem in Juarez and other Mexican cities. How successful have you been in reaching out to families? So I think you said 27 from Mexico?
Originally 27. We're up into about 89, 91. Some of the families do the bouncy thing, and they go back and forth. So we stay in touch. They're getting medicated, but where they are today could be in either place. So we're looking at probably about 90 children in Mexico that we're dealing with. The ones in Juarez are kind of nice because they're close by and they can come across. Some come here for their treatment, but some have moved deeper into Mexico, so we've been working with health departments in other states.
Even though you say that 95% of the patients have been contacted, only 66% have completed the screening. What would be the message of those parents that maybe brought the babies to the initial screening, maybe the test, and they didn't proceed with the X-rays?
Let me answer the number question. You can answer the medical question. 66% of the total babies are what we have seen here at the health department have completed. If they're one of the 90 in Mexico, they're not part of that number. If they're one of the 50 in New Mexico, they're not part of that number. We'll eventually be gathering that. So 66 is the absolute low number that we can attest to today that those babies have been taken care of. As we gather the reports, that number will grow.
And also, we have been inviting those parents that also came for the initial visit, but didn't come back to complete the screening. We need to complete the screening and invite them to come. That's another reason why we have a low number too, because there might be some that got lost and didn't come back for the reading and didn't complete the first screening. Also, there's some other pending for whenever they're 6 months. They need to come back, and they're already been given appointments for later on to complete the second part of the screening for those that need it.
Once the baby, Dr. Carranza, and just to clarify, once the baby has the skin test, it needs to be
Needs to be ready.
within the X-ray, within the next 48 hours, or what if they do one part of the screening and then they miss the other part? How do they need to start the process again?
No, actually the important part is for the babies that get the skin test right now, they need to come back in 48 to 72 hours. That is the important part. If they want to do the skin test today and go tomorrow for the X-ray, that's fine. But as long as the skin test gets read at the right amount of time.
What if it's past those 72 hours? Do they have to redo the process again with the skin test and the X-ray within the 72 hours?
They need to redo the skin test. If they did the chest X-ray and that one was fine, then they just need to come back for the redo the skin test.
Of these 608, 860, how many are from Mexico too?
Looks like about 90 right now, and some have dual addresses, so we may never know, but at the very highest it would be 90. 91. 91.
Did you answer 9 and 2 or 10 and 1?
So what I have is 7 U.S., 4 that list either Mexico and or U.S. assets. So national or
Did you get that?
Can we repeat it? We have
So-
7 that list only a U.S. asset.
I think it needs a microphone.
Oh.
So 7 for sure U.S., 4
List both Mexico and U.S.
have
assets.
dual residency.
And out of, maybe just specific, but out of those 7 and out of those 4, which ones have received the BCG vaccine?
So I knew that was the next question.
Yeah.
I see it. Of the true positives, all appear to be USA.
Anything else? If not, thank you so much. We really appreciate your help. This is help. Know that 5% we can't reach, this can help, so thank you.